Now, we've mentioned the lady from Sweden, the physician who couldn't practice because she came out and was prescribing the diet. Well, it's not unique to Stockholm. Karen Zinn was here as our expert witness. And she has an action against her in New Zealand for standing up and prescribing a low carbohydrate for diabetics and people with metabolic disease. And that is a sense why we asked her to be an expert witness, because she actively uses the diet. What's really interesting about Karen Zinn is I taught her in 1980s, and I taught her all the wrong stuff. So she had to go to New Zealand. And when she arrived in New Zealand, she'd been there for many years, and she also had this own Damascus Road movement. And she decided to try the low carbohydrate diet. She found it worked, and then she found it worked for her patients. And so she wrote this document that I sent to the HPCSA when I was first charged. And I believe that this information would be helpful for them to decide whether or not we should go ahead with the hearing. But my point is, and New Zealand has recently changed the rules. And this is the danger that we face in this country. They've changed the rules that now there are dietary guidelines, and if you are in practice as a dietitian and you do not follow those guidelines, you cannot practice dietetics. And those guidelines are, guess what? Low fat, high carbohydrate, for which there is no scientific evidence. So you have to ask the question, what's going on in New Zealand that there has been such influence that it is now impossible for a dietitian or a physician to prescribe anything but the high carbohydrate, low fat diet, for which there is no scientific evidence. And it doesn't end there. If we go across the Tasman to Australia, Jennifer Elliot is a dietitian in Australia who started prescribing the low carbohydrate diet for her diabetic patients, and she's banned from practice after 35 years practicing as a dietitian. She was banned from practicing. Her livelihood was taken away from her. And it didn't happen long after she wrote this article, which you have in your discovery. And you have to ask, how is it possible that you can write a scientific article and as a consequence of that you can be banned from practicing your profession for which you have trained and for which you have been working in for 35 years? So in part my error was to get involved and to be involved in the 2012 University of Cape Town Faculty of Health Sciences Centenary Debate, and then to publish my article, which is critical of the dietary guidelines and so on. And one wonders to what extent that this was also influential in making people get unhappy with me, and as a consequence led to this hearing. Now, we've discovered this entire document, and it's really a crucially important document because it's provided by Credit Suisse, who spent an inordinate amount of money and got many scientists to look at the question of what's the future of nutrition. 3 years ago, they came out with a document on sugar, and they warned those people who are investing in the sugar market to get out because sugar is collapsing as a global commodity. And exactly what they said has happened, and sugar sales globally are falling dramatically. And out of the blue, they produced this document, and it's called Fat, the New Health Paradigm. And this is the results of their research. And they have to be pretty much correct because they're advising people how to invest in the future. And they go to the best evidence and the best people to develop those ideas. And I've given you a lot of evidence because this is completely independent. These are not medical doctors or dietitians producing their guidelines or whatever. This is an independent organization that's interested in financial markets and how they're going to be impacted by the new information that's coming out. And so we're going to go through them at length, but again, it is in the discovery and it should be read by everyone. So I'm going to go through, these are probably the most important conclusions, and then I'll show how they come to those conclusions. So we've concluded that natural fat, and natural fat is what we should call healthy fats. A lot of people now are talking about eating healthy fats. Well, natural fats are what are produced in animals and in plants, is lower than ideal. If anything, could increase safely well beyond current levels. Saturated fat consumption declined between 1930 and 1960. And they concluded, which I suggested in the first day, that smoking and alcohol were far more likely factors than saturated fat consumption behind the heart attack epidemic. And recall that the smoking epidemic and the heart disease epidemic just go in parallel. And I indicated too that stopping smoking immediately reverses heart attack rates. And again, it acts because it must prevent the plaque from rupturing, and that's key. Saturated fat has not been a driver of obesity. Fat does not make you fat. At current levels of consumption, the most likely culprit behind growing obesity levels of the world population is carbohydrates, and that's the argument I presented. A second potential factor is solvent extracted vegetable sick. I put the sick in because they're not vegetables, these are grains, oils, canola, corn oil, soybean oil, sunflower, and cottonseed oil. So this is the first time that they're saying actually these vegetable oils, which we've been told to eat instead of the saturated fats, may not be healthy. And one of the points I made in Science is you must look at the paradoxes. And the paradoxes tell you more than the rest of the information. And he introduces 3 paradoxes. A proper review of the so-called fat paradoxes, France, Israel, and Japan, suggests that saturated fat are actually healthy, and omega-6 fats, those are the ones in vegetable oils which cause inflammation, are not necessarily so. What are the fat paradoxes? The fat paradox for France should actually be European paradox, because it's the European countries that have the most saturated fat have the lowest rates of heart disease. So it's actually not the France paradox, it's the European paradox. Israel is really interesting because in the Middle Ages, the Jews were the healthiest populations in the world. Whenever there was an epidemic that went through the European countries, it was the Jews who did best because they had specific health activities. They understood infection before bacteria were understood. They knew how to keep themselves clean and sterile. And so they lived better than anyone else. Today, they're doing much worse. And in Israel, the Israelis are doing worse than the Arab Palestinians living in Israel. And the reason is they're eating omega-6 fats. They have one of the highest intakes of omega-6 fats. And that's the idea. And they have high rates of cancer. And if you're looking for a population which shows the negative effects of vegetable oils, it's the Israeli paradox. Now, Japan is really interesting because Japan, we're always told they eat little carbohydrate and they're amongst the healthiest people they eat lots of carbohydrate and they're very healthy, which is absolutely correct. What's happened in Japan in the last 10 years or so is that they're eating more and more fat, their cholesterols are going up, and guess what? Their heart disease rates and their stroke rates are rushing down. So they do the exact opposite to what we would expect. So they're a population that's going from a higher carbohydrate diet to a slightly higher fat diet, and their rates of heart disease are falling, which suggests it's not the diet that's the key factor. So doctors and patients focus on bad and good cholesterol is superficial and best and most likely misleading, and we discussed this with the analogy of the good and the bad. Ambulances, cholesterol is cholesterol is cholesterol is a chemical. It can't be good or bad. It is what it goes with, the lipoproteins that are dangerous. And we mentioned it's the small dense LDL particles which become oxidized, which get stuck in the arteries. And those are caused by people with insulin resistance and a fatty liver because they're eating high carbohydrate diets. And I showed you that evidence at length. So if we're going to talk bad cholesterol, we have to talk bad cholesterol, non-alcoholic fatty liver disease, insulin resistance, high carbohydrate diets. That is what causes bad cholesterol. What causes good cholesterol is high fat diets in people who are not insulin resistant and do not have a fatty liver. Total bad cholesterol and LDL cholesterol are poor indicators of heart disease risk. I showed you they're almost irrelevant predictors of risk. I showed you that they have a relative risk ratio of 1.2, and after lunch we're going to discuss at length what does a relative risk mean. In women in particular, total cholesterol has 0 predictive value for all causes of death. Yet I'll bet every woman in this audience knows her cholesterol. What for? It's a complete waste of time. In contrast, low blood cholesterol in men could be as bad as very high cholesterol. And the best indicators are the size of the LDL particles and the ratio of triglycerides to HDL. Remember, High triglycerides, low HDL is a high carbohydrate diet. Low triglycerides, HDL is a high fat diet. The intake of saturated fat, butter, palm, coconut oil, and lard poses no risk to the heart. Saturated fat is actually a healthy source of energy, and it has a positive effect on the LDL pattern. In other words, high fat diets increase pattern A, which is the large LDL particles, and reduces the small, bad, dense LDL particles, pattern B. The main factor behind a high level of saturated fat in our blood is actually carbohydrates, and I presented the evidence for that. I showed you Jeff Ehrlich's study clearly showing that. Not the amount of saturated fat we eat. And saturated fat in the blood isn't a good idea, and it's tied to carbohydrates, not fats. Clinical trials showed a low carbohydrate diet is much more effective in lowering the level of saturated fat in our blood than a low fat diet, and that's the work of Jeff Ehrlich. More research is therefore needed before anyone can assess the full impact of a high level of omega-6 intake on health. So they're putting out the point that polyunsaturated omega-6 intake may not be as healthy as we think. And this is interesting. Doctors, nutritionists, and consumers show superficial knowledge on the potential benefits or risks of increased fat consumption. And how could they know? Because there's a convention, and the convention is what's taught. And my problem is that I took on that convention. But that is it. Where do doctors, nutritionists, consumers get their information from? They get it from the conventional advice. Their views are influenced significantly more by public health bodies or by WHO and AHO than by medical research. And in a sense, I hope I've shown that, because when you look at the evidence, it's a pack of cards and it just disappears. So the evidence must have come from somewhere else. And the World Health Organization, the American Heart Association. And you have to know who funds the World Health Organization. And when did sugar last save the World Health Organization? When did the sugar industry last bail out the World Health Organization? And you need to know who funds the American Heart Association. Coca-Cola was certainly one of them, because they acknowledged that. Why would American Heart Association want to be involved with Coca-Cola? The stance of most officials and influential organizations such as World Health Organization and AHA is now so well behind the research in two main areas: saturated fats and polyunsaturated omega-6 fats. So that's his assumption. So if the World Health Organization and the AHA are meant to be leaders, why are they behind the rest of the knowledge? We also expect a review of the natural stance on carbohydrates. Carbohydrates are one, if not the major causes behind the fast growth of metabolic syndrome cases in the US, 4% a year, which includes type 2 diabetes and obesity. And I've explained at length why that is so. And this is the future. So if you want to invest in industry, this is what you should be doing. Among foods, the main winners are likely to be eggs, milk and dairy products, cheese, yogurt and butter, and nuts, with annual rates of growth around 2.5 to 4%. The losers are likely to be wheat and maize. Wheat and maize. I hope the wheat and maize growers are looking and seeing that. And to a lesser extent, solvent-extracted vegetables, mycic oils, the seed oils. Meat consumption should grow at 1.4% a year and fish at 1.6% a year. Our market survey shows that most consumers' and doctors' perception on fat are aligned with the official nutritional recommendations. There they are. They are conventional. And we've shown that they are not. Conventional is not correct. Yet some consumers are clearly making new choices. Consumption of butter is growing globally at a rate of 2 to 4% a year. And in the first half of this year, volume sales of whole milk in the US grew 11%, while skim milk shrank by 14%. I'm really glad to see when you go to Woolworths the extent to which the butter's so much bigger, the margarine's much reduced. Egg consumption in the US has grown by 2% and organic egg consumption by 21% in the last 12 months. So we believe that we are at a turning point, and I'm just hoping that this hearing is going to be a turning point. Because for the first time, we've had 40 or 30 hours of information. And hopefully people are going to realize that there's a lot of evidence behind what we're saying. Our own analysis and the most recent medical research support these new trends. Medical research has shown that eating cholesterol has basically no influence on the level of cholesterol in the blood or on potential heart diseases. Neither has the link between saturated fat intake and cardiovascular risk ever been proven. On the other hand, a high intake of omega-6 polyunsaturated fats has not been proven as beneficial for our health, and trans fats have been shown to have negative health effects. The higher intake of vegetable oils and the increase in carbohydrate consumption in the last 30 to 40 years are the two leading factors behind the high rates of obesity and metabolic syndrome in the US. Saturated and monounsaturated fats are not, and those are the fats that we should be eating. Those are the healthy fats. So the conclusion of this report is simple. Natural unprocessed fats are healthy and key to the evolution of a society that focuses on developing healthy individuals, not just on treating those who are sick. And I might add, treating those who are sick ineffectively. Natural fruits high in monounsaturated and saturated fats are one of the preferred sources of energy for our bodies to use and store. Omega-3 fats have strong protective properties for our heart and brains. Welcome to the new world of fat.